welcome everybody to this panel. Today we have Jo Neill, who is a professor of psychopharmacology at the University of Manchester. She is working with the Policy of Manchester and Drug Science to educate the public about the urgent need for drug law reform and enable research into illicit substances. After Jo, we'll have Mitchell Gomez, who has been with DanceSafe since 2014 and is a passionate advocate for reality-based drug policy and harm reduction. Following him, Lianna Gilooly, who is an advocate for social justice and drug policy reform and has a lot of experience in the cannabis industry, and she is currently working with MAPS. And then finally, Nicholas Spears, who's an anthropologist, documentary filmmaker, and has a master's degree in visual anthropology from the University of Barcelona. And he's interested in the sensory experience of audiovisual mediums. So after these talks of 10 minutes each, we'll have a little Q&A, and I hope everybody enjoys. So the floor is to you, Jo.
Thank you very much. I'm excited. I've not met many of you before, so this is great. So thank you very much for the invitation to you, Aidan, to Richard, to Drug Science, of course. And I'm absolutely delighted that we're having this panel on the myth busting about psychedelics. And there seem to be many myths, and I would say they're probably the most heavily stigmatized of all psychoactive drugs. It's great timing this because with Drug Science, we've just published a paper on this, really looking at the myths and looking at the evidence for, a lot of the misconceptions about psychedelics. So as we all talk to people of all persuasions about psychedelics, it is really interesting the misconceptions that people have. And just as an example, I was giving a talk about psychedelic medicine to the neuroscientists at Manchester Uni, and they're smart. In the pub afterwards, one of the guys said, well, you cannot advocate treating people with psychedelics because they're so dangerous, and that's a neuroscientist. So the media and misinformation has really permeated society. I think we're coming out of that, but let's see. So I'm chair of the Medical Psychedelics Working Group for Drug Science, and I've been working with Drug Science for quite a while now. Total privilege. One of our aims is destigmatization through our outputs, looking at the evidence and our policy work. So I'm an animal researcher, and I worked in drug discovery for all my career, which is nearly 40 years now, which is scary. And this is drug discovery, very early stage drug discovery for new medicines for psychiatry. And I can tell you that really, in terms of patient benefit, we have achieved very little. Psychiatry drug discovery hit a brick wall. Big Pharma pulled out about 15 years ago, huge failures in phase 3 trials. And I would say we've had little innovation and success in treating people with hard to treat health conditions. We're talking serious trauma, addictions, PTSD, severe depression. But plant medicines are changing all this, and I am so excited about this. That's why I've decided to spend the rest of my career enabling this to happen. And what I tell people about psychedelics, 4 key things which are so different from any other medication for psychiatry. So first of all, they heal people, and we don't talk about healing in psychiatry. We talk about managing symptoms and managing a side effect burden. So that's the other thing. The paradigm, this is a complete paradigm shift. The paradigm is so different, up to 3 reasonably high doses with a lot of psychotherapy, a lot of care, a lot of preparation. That's an extraordinary treatment regime. Most drugs we have to take every day, and therefore we have toxicity and a large side effect burden. And this is just not the case for psychedelics. So that's extraordinary and particularly innovative, I think. The effects seem to last a long time, perhaps due to the neuroplasticity effects in the brain. And that's something we've got the tools to really explore this in quite a lot of depth now, and that's exciting. And they're relatively safe. So Albert Hofmann, LSD, father of LSD, lived to be 102. So we're talking about psychedelic assisted therapy for these very hard to treat conditions, but we must remember that no drug is entirely safe. And what we're talking about is an altered state of consciousness. So are psychedelics physiologically safe? Let's look at that for a minute, and I promise I won't talk for too long. What does the law say? Well, we had the policy session before this. They're Class A drugs and Schedule 1. So the law perceives them as having no medical use. That's the scheduling. And the most harmful of all illegal drugs with the stiffest penalties for possession and supply. And that's a mystery to all of us who understand about the pharmacology and the effects of psychedelics. So A, they do have medical use, and B, they're relatively harm-free. So if we look at the MCDA analysis done by David Nutt and Larry Phillips, so that's the Lancet paper, I'm guessing most of you are familiar with that, way back in 2010. This is the multi-criteria decision analysis where they compared all drugs that we use and abuse for their harm to self and harm to others. So alcohol came top, surprise. Heroin, methamphetamine, cocaine, crack cocaine cause harm to society, harm to people. The psychedelics pretty much come nowhere, way down at the bottom of the pile. So MDMA, ecstasy, mushrooms, LSD really come in last there. So in terms of harm to self, harm to others, they're pretty safe. And what about this review that we've just completed? We looked at several features from the data that we could sort of access, and then one caveat is that some of the data isn't particularly good, really, especially the quality of the information, especially from the early trials. But we looked at overdose risk, neurotoxicity, cardiovascular risk, dependence, harm to self and others, challenging experiences, and HPPD, so hallucinogen persistent perception disorder. Briefly, now Aidan, I can see that we want to get on with this. For psychological risk, it's all about being in the right mindset and being in a safe place with the proper care. Certainly this is a challenging experience. You've only to watch the Magic Medicine film to see that this is a difficult experience for people. And in unprepared people, in unsafe settings, of course, people can harm themselves. And there is evidence of this being lethal, but it's incredibly rare and much rarer than drugs like alcohol. Psychotic experiences are also rare and mostly in people with risk factors. And for the effects to last a long time, more than 48 hours, also pretty rare. So that's what we found. And even a bad trip, bad experience, challenging, can lead to positive outcomes after a period of time. And if we look at the observational studies coming out more recently, people show better mental health outcomes, better mood, better connectedness with nature after using these substances. And of course, let's not forget that they've been used by indigenous populations for thousands of years. And one of the meetings for me that really helped me to understand the power of these medicines is I met a combat veteran with significant trauma, very severe trauma. And he prepared himself very, very well, went to Holland and took a couple of doses of truffles, so psilocybin truffles, in a hotel room in Amsterdam over a weekend, and came out healed. I mean, it's really not the right way to do it. He should have had more psychological support, but he had prepared himself very well. So, that's extraordinary. So all these stories you cannot ignore. What about the dependence risk? That's really not there at all. So they don't produce euphoria. They have very fast tolerance due to their pharmacology. You don't get dose escalation in people, and there are no known withdrawal symptoms. So they don't meet any of the criteria for having a dependence potential. And they, the use does not appear to be compulsive. In fact, we now see that they're being used successfully to treat dependence. In terms of toxicity, we couldn't find evidence for neurotoxicity. In fact, with the neuroplasticity, improved cognitive function and neuronal function, improved types of memory, working memory. Cardiovascular pathology potentially could be an issue. Remember that the body is awash with serotonin, 5-HT. Psilocybin and DMT are structurally really similar to 5-HT. So they're bound to be effects on the peripheral system. And of course, something that, well, loads of this is in the gut. Something that's interesting though is that serotonin is pro-inflammatory itself, but psychedelics are anti-inflammatory. So we have a potential there for treating inflammatory disorders. Overdose risk seem to be very safe at standard doses, certainly used in the trials, safe in overdose. There have, of course, been deaths reported when mixed with other drugs or absolute heroic doses. But again, that's very, very rare. And HPPD is very interesting. These are long-lasting visual disturbances. And they're in the DSM-5, you know, the Diagnostic Statistical Manual of Psychiatric Disorders. But none of this has been seen in recent trials, and the prevalence does seem to be low. I met a chap doing his PhD on this, so I think we need more research actually. And I'm going to finish there and let you others speak. So I hope I haven't gone on too long there, Aidan.
No, not at all. Thank you very much, Joe. Unfortunately, I had mentioned Nick. Nick is going to be on tomorrow on the traditional versus Western use panel. I was just a little bit too excited and waiting for his talk to happen, but just to clarify that. So next up we have Michelle Gomez, followed by Lianna, and then we'll have 30 minutes of question and answer if time permits. So to you, Mitchell.
Yeah, and I was editing my notes here, Joe, as you were saying things that I had planned on saying. So I was pulling things off of my little notepad here. Yeah, so my name is Mitchell Gomez. I'm the executive director of DanceSafe. So DanceSafe is a harm reduction and health education nonprofit here in the United States that primarily deals with what I would call the harms of prohibition, not actually the harms of drugs themselves. But one of the areas where we do sort of engage more deeply with the harms of drugs themselves is in the sort of area of misinformation. So that's why I thought this was a super interesting panel and wanted to hop on it. Before I dive into the meat of this, Joe, you mentioned indigenous use though. I just did want to point out that when I do talks, I always put my Mayan mushroom stones in a place where people can see them. So these are a whole shelf of evidence of psychedelic use that predates any country that has banned psychedelics by quite a lot. So yes, I try to keep my personal motivation close by. Yeah, and I'm interested in harm reduction for a lot of reasons, but the primary reason is that when I was younger, 14, 15, I'm 40 now, I engaged in a lot of very, very reckless substance use. And a big part of why that substance use didn't really harm me is that the markets at the time were just less adulterated than they are now. You know, things people called LSD were primarily LSD. With MDMA, the worst case scenario was maybe some methamphetamine cut into a pill, which in terms of what gets cut into pills now, that's sort of very innocuous misrepresentation compared to things like alpha PVP or some of the sort of next generation cathinones. And so, yeah, I have a lot of sort of personal motivation towards this movement because I do really think the reason I survived that time period was timing. It was just a safer time to be reckless in your substance use. And yeah, there's probably as many definitions of harm reduction as there are people who are interested in harm reduction. But the one I really like is that harm reduction is a movement for social justice built on the belief in and respect for the rights of people who use drugs. That's the Harm Reduction Coalition. And that's really where my motivation comes from. I just don't think that we can end drug use. I think that we can mitigate drug harms. And unfortunately, the government has chosen to make drugs more dangerous. They've chosen harm maximization policies again and again and again for the last 50 years and created a really dangerous world because of this. And yeah, DanceSafe does an awful lot of things, but we really are at our heart peer educators. So we go to these events, we train people who are parts of these drug using communities, how to educate their peers. And obviously a lot of that deals with misinformation, particularly around misrepresentation, adulteration, and all of those sorts of issues within the markets, and also educating drug users about their rights, because for the vast majority of these substances, Joe, as you pointed out, for the vast majority of them, the most dangerous thing that might happen is you get caught with them, particularly in the United States where our laws sometimes are really egregious. I have a friend who was just recently released from prison after serving 7 years for possession of LSD, not possession with intent to distribute. This was a simple possession charge. It was his third drug possession charge, but he had not ever been charged with distribution, with any sort of other crimes, like no guns, no violence. And yeah, I just served, I think 6.5 for simple possession of LSD, right? Which is far more horrible than anything that's going to happen to you if you just take LSD. I mean, LSD is a physiologically non-toxic substance. There is no known fatal dose for LSD. And so to treat a drug like that as a more egregious crime than we treat, sexual assaults and in some cases murders. I mean, there's people who've committed homicides who didn't serve the amount of time that people have served for LSD, I think is really, really egregious. Oh, 10 minutes is not a lot of time. So I do just really want to point out that most of the harms people associate with these substances are harms created by prohibition. LSD is non-toxic. We don't know of any case where a person has died from a physiological drug death. But people, taking 2,5-IN-bomb or some of these other substances that are being called LSD, we had a wave of deaths a few years ago that was certainly over 100 globally from people taking what they thought was LSD that actually was 2,5-I. And we do see sort of waves of misrepresentation happening. I know in the UK, PMA and PMMA showing up in MDMA pills has caused quite a lot of problems. We don't see that one as much in the US, but we do see a lot of different sort of random cathinones being pressed and called MDMA. Things originally like butylone and methylone that now a lot of people kind of wish were around. And now more recently, things like alpha PVP, which have caused what looks like long-term amphetamine psychosis after a single dose. So people take one pill of what they think is MDMA, a drug which is physiologically relatively safe, and experience what looks like weeks and weeks and weeks of amphetamine psychosis. I mean, really long-term effects from alpha PVP being misrepresented. And so while DanceSafe is out there doing drug checking, and you guys have the Loop in the UK, and there's organizations all over the world, a lot of that is just mitigation. And I do genuinely believe that legalization and regulation are the only sort of long-term solutions to most of these problems. And not just for medical use. I get a lot of shit from medical people on this, but I am a full stop cognitive libertarian. I think humans have a right to alter their consciousness. And I think that the government should not be making that use more dangerous. They should be making it safer. And the way to do that is to create legal regulated markets, not just for psychedelics, because even things like opiates, even things like cocaine and methamphetamine are only made more dangerous by being made illegal. And so I really am talking about full regulated markets. But while we're talking about dangerous myths, I think the two that annoy me most, the first is that, you can trust the press. People are like, oh, I've had this this Superman, or I've had this Tesla before, I know it's MDMA. You don't know it's MDMA. Even years and years and years ago, before pill pressing technology got as easy to access as it was now, we would see a flood of real MDMA of a single type of pill. The blue dolphins are sort of infamous for this in the United States, where a wave of blue dolphins would enter a city, they would all be MDMA, and then immediately a wave of blue dolphins would enter that were all methamphetamine, because methamphetamine costs less. So you could get the press to have a certain reputation and then sell a bunch of meth as MDMA and make a lot of money because of the price differential between those substances. Now, literally, people can 3D print dye presses. So replicating a pill now is something that probably hundreds of thousands of people can do in their homes. There is absolutely nothing to stop a person from, scanning a pill, 3D pressing a dye, and pressing sugar to look just like it. That is off the shelf, very easy technology. And unless you personally test the individual substance you're planning on taking, you just don't know what you're taking. And so that's just the reality of drug markets right now. The other one that annoys me are all the stories around LSD, because LSD is a substance that's existed for quite a long time. There's a lot of research on it, and yet we still hear these same stories over and over and over again. I don't know if my friend took LSD and thinks he's a glass of orange juice and refuses to lie down story is as common in the UK as it is in the United States. I've heard that story from hundreds of people for 20 years. You do not have a friend who believes that. The idea that LSD can be absorbed through your skin is just not true. Law enforcement believes it. Lots of people who use LSD believe it. You just don't realize how often you rub your eyes, right? If you're touching LSD crystal and laying LSD blotter and touching your eyes, like, yes, you're going to hallucinate. But really, the sort of meta dynamic that I think needs to be addressed is people who are overly sure in their beliefs just because they heard it from a friend. There are lots of websites out there where you can look at medical research. You can, anything you believe about drugs, Google that story and the word debunked and see what happens. And one of the things we try to drive home to every DanceSafe volunteer, and that I would drive home to every substance user, is that it's okay to say you don't know. right? If somebody's asking you about drugs and they're interested in trying psychedelics, and you think of yourself as an expert, and they think of you as an expert, and maybe you are an expert in some ways, and they ask you a question that you don't know, like, it's okay to say that. And I say it all the time. Like, I want to go do research all the time on things that I don't know about. And I've spent time with retired and time served LSD chemists who are willing to say I don't know. And so if those guys can say I don't know, you can say I don't know. And also, please, please, please test your drugs, because it's a much more dangerous market now than it was 10 years ago or 5 years ago. I think that was just about 10 minutes. I think I did it. That's amazing.
Yes, wonderful. Thank you very much, Michelle. Nice talk. Is nice to hear your perspective as someone with plant state of how it's a different market now with 3D printing pill presses. Never something that had occurred to me. So thank you. Lianna, if you'd like to go on and deliver your talk. We're at 5:52 GMT. So if you'd like to do 10 minutes from now, we'll still have ample time for the Q&A.
Sounds good. All right. Thank you so much. Just before I dive into some of my perspectives, I'm just going to share a little bit more about my background and current work in the field, just to anchor that in. I've been working for the past 5 years as on a very small team raising major gifts funds for MAPS. In addition, I'm on the board of the Chacruna Institute of Psychedelic Plant Medicines, which is kind of like the sister organization for MAPS, but looking at the sociocultural elements of incorporating plant medicines and the globalization of the use of plant medicines. And in addition, I'm on the board of North Star, which most notably created an ethics pledge with the input of hundreds of stakeholders across the field of psychedelics for anyone who wants to engage in the field of psychedelics in a for-profit context. So people who are starting companies or want to join companies, it's just kind of like the first thing that we created was some sort of guideposts about how to orient oneself when engaging in that realm. I want to kind of take things maybe into a different, I don't know, realm here. But the thing I wanted to share the most is the myth that everyone who takes psychedelics comes upon the same pro-social insights and realizations, right? That, you know, we heard Joe mention a few of nature relatedness, this unity experience, increased empathy. These are all hallmarks of the psychedelic experience. And so one thing that I've become acutely aware of over the past few years is that that might not be true for everyone. And there's a huge role that set and setting plays in terms of informing what kind of insights a person might get in their experience. And the set and setting isn't just the immediate set and setting of your environment and how you're showing up to what's in your mind, but the cultural set and setting as well can play a huge role. And one of the things that's evidence of this is something called the conspirituality movement. I'm not sure if people are familiar with this, but it's kind of the intersection of people who identify as spiritual and people who have, a strong belief in conspiracy theories. And there's been a lot written about this. There's a conspirituality podcast and some blogs and Medium that I would recommend checking out. But the main gist here is that the same qualities that might make a person open to having a relationship with their spirituality and spiritual experiences, like the belief in magical thinking, this understanding that we're all connected and there's some great plan that I'm a part of, that those kinds of qualities can make a person susceptible to believing in certain conspiracy theories and other kinds of thinking. There's a great book, pardon my French, this is the title of the book, it's called Mindfuckers, and it's about cults from the 1970s that were oriented around LSD. Famously, there's the Charles Manson cult, but there's this like huge, there was much more of an awareness of the vulnerability that people can enter into when they're undergoing psychedelic work, and that what they feed and fuel themselves with, what is the pond of information and cultural and contextualization that they have access to, can inform one's worldview. And I just wanted to highlight that as something that, we often promote, the health benefits and the wellness, and obviously I work at MAPS, that's like what we're all about, is demonstrating scientifically that there are in fact ways to use these tools very skillfully to create the potential of having a positive, beneficial, or healing experience and decrease the possibility of having a difficult or challenging experience. But these tools, that can cause so much generative growth and healing in our lives, they also do have the potential to cause harm. And so this skillful use of these tools is just something I can't highlight it enough, and there's shamans in more traditional cultures train their entire lives to then be able to facilitate these kinds of healings. And so I think there's something to be looked at deeply in the way that we continue to onboard psychedelics into our culture and into our society. They're very powerful and they must be wielded with extraordinary care. And I think it's important to have an awareness of the ways in which one might become vulnerable through these explorations. Part of that is this idea of very clear narrative around psychedelics is that they dissolve the ego, this ego dissolution phenomena. And one thing I can share is also I think in 2019 or something, there was a survey done about 419 or so participants were surveyed, and they were able to conclude that those who experience this awe state that is inherent within psychedelics, that it might be linked to lower levels of narcissism. And they were basically postulating that, have we, and then all these, articles, clickbaity titles come out about how psychedelics might reduce narcissism or might help with maladaptive narcissism tendencies. And I think that that's definitely worth looking more into. That being said, and this is anecdotal, but also there's been extensive writing about this. I've also seen the opposite happen, where it's almost like a rubber band effect, where it goes from this ego dissolution experience to your ego bouncing back stronger than ever. Some people get the message that that I am God, but fail to get the message that so is everybody else. And so I've actually seen psychedelics be incredibly ego reinforcing as part of the experience and part of the state. And yeah, there's this other thing that I think we at MAPS are very aware of, right? We've had members of our trials become very disappointed when they realized that they were in the placebo group because there's so much positive media out around psychedelics. And so this question of are we able to truly accurately blind the study? I mean, we are doing that, and we're following, the most rigorous protocols available. And people also might be part of the population where the intervention did not work for them. In our case, it's MDMA, assisted psychotherapy for the treatment of PTSD. And so we have this strong narrative, and I understand why, right? We've had to fight so hard for so long to get people to understand that there is something extremely worthwhile in learning how to skillfully work with psychedelics. And they're not a panacea. Unfortunately, they do not help everybody. And there is certain patient populations that might need to be screened out, or where psychedelics might actually not be beneficial and potentially harmful for them. And that whole area needs more research. We need to understand that better. We have some sort of baseline understanding of what to look out for. But we've also, in my opinion, over-screened people that might benefit because we're so wary of potential adverse events. So this is people with maybe bipolar disorder, schizophrenia. There is at least one scientist I know who believes that he's discovered an alkaloid within ayahuasca that can treat bipolar disorder. So I think that there's a lot for us to still learn and understand. And it's also very true that these experiences are not going to be suitable for everyone. And that, part of our exuberance about psychedelics needs to be mitigated with that narrative of caution when approaching this work. And yeah, another myth that I'd like to bust is actually specifically related to MAPS. And that is that MAPS is pushing solely for the medical model. Rick Doblin founded MAPS almost 36 years ago. Actually, I think it was her birthday yesterday. And so So yeah, and he's been fighting really hard to demonstrate through science, through drug development, through FDA trials, that there is, scientifically validated use for psychedelics for healing. That being said, we have now the MAPS Public Benefit Corporation, which is wholly owned by the nonprofit. And the MAPS PBC is where we house the drug development work, the scientific research, and we will eventually, in the event of FDA approval, be able to manufacture and distribute MDMA. Separately, we have the MAPS nonprofit, and I'm so proud of the work that we have done in terms of policy and advocacy. The mission of MAPS is to create safe and legal contexts for the beneficial uses of psychedelics. So that can mean spiritual, it can mean religious, it can mean in contexts where we decriminalize drugs and regulate drugs according to their harms. That is the core philosophy of MAPS. We see ourselves as an organization that is part of dismantling the war on drugs and demonstrating that we can create a safe pathway to incorporate these powerful experiences into our culture and into our society. We are also, doing mass education programs. We're working on a training that's designed specifically for first responders and law enforcement. So it's like the public health framework for a post-prohibition world. And we're beginning that work. And also, at risk of talking too much, there's this idea that people think that the only way to distribute psychedelics safely is through medical clinics. I don't believe that is true. There's going to be a multiplicity of formats to receive these experiences in, and I'm all for the community-generated grassroots, culturally competent centers where people might heal in groups of their peers. And so I think that there's a lot left to uncover and to work towards in those realms. So thank you.
Yes, thank you so much, Lianna. Really wonderful talk and a nice alternative perspective on how things are going in this area. The work coming from MAPS at the moment is really fantastic. It's nice to see it just keeps getting bigger and stronger as the years go on. So we have about 25 minutes to do some Q&A. Thank you so much, Joe, for answering questions in the Q&A box. That was really helpful. We might have time for some more now. So the first question right off is, I suppose, a question for all the panelists. You might like to chime in on this. What do you think is the most harmful myth about psychedelics, of the ones that do exist?
Yeah, so the weird dynamic of the way I speak about psychedelics is that I get accused of being pro-drug by people who are anti-drug and anti-drug by people who are pro-drug. I think probably the most dangerous myth of psychedelics is that they're safe for everyone. That's just not true. The risk profile of them is exceedingly low. But people who have family history of severe bipolar or schizoaffective disorder, like, there are very real risks. And I've seen an incident personally, like within my social circles, of a person who didn't know they were adopted. Their mother was schizophrenic. They started using LSD and triggered latent schizophrenia. Like, I saw that happen. It was horrifying. We're talking 20 years later, she still has, like, she triggered lifetime schizophrenia by using psychedelics without knowing that her mother was diagnosed schizophrenic. And so this idea that they're safe for everyone, I find to be really, really dangerous, because they are certainly far safer than alcohol, tobacco, plenty of other things for most users with, what I would sort of call, neurotypical, structures, like most healthy, psychologically healthy people with no pre-existing conditions. Like, yes, these things are far safer than plenty of other things we let society do, but they're not safe for everyone. And pretending that they are can be really, really dangerous for those small percentage of people that they're not safe for.
I would completely agree with that, Mitchell. And I've met a few people who've clearly felt the need to take them and have had a long-lasting bad experience, and being in really not taking them for the right reasons, I think. And you're absolutely right. They're clearly not safe for everyone and not suitable for everyone.
Yeah.
Yeah.
Yeah, and I do think a close tie with that one would be that like legal and illegal are good measures of risk, right? People think, oh, like because I was able to buy this like research chemical legally, it must be safer than these other things. And that one has also caused just like lots of problems over the years. And so yeah, just because something is illegal doesn't mean it's dangerous. Just because it's legal doesn't mean it's safe.
Yeah, so certainly agree on that last point, Mitchell. Especially in your mention of the research chemical cathinones that are often passed off as MDMA. But a follow-up question of these, there was a question asked anonymously in the chat, but for Mitchell directly. What do you think about the regulation of substances which are more prone to addiction, such as cocaine?
You're on mute, Mitchell.
You're muted, Mitchell. Yes, thank you.
Always. Sorry, I have an Indian street dog that we shipped home from Delhi who occasionally makes some loud noises. Yeah, I think Transform Drug Policy is this amazing organization that released like a models for regulation. And I do tend to find myself agreeing with them like 95%. And so I believe their idea for cocaine was basically like a specialist pharmacy. So it wouldn't require a prescription, but you'd have to go in, you'd have to explain why you want the drug. There would be a medical professional to evaluate you, and they could dispense the substance or not. I actually think that cocaine does not really deserve its reputation, particularly if it's taken through oral administration. So things like coca tea or just drinking cocaine tend to have a sort of slower come up, a longer duration, a slower come down. And I know a lot of people who've stopped using sort of insufflated cocaine by using oral cocaine. They found they enjoyed the experience just as much, but it didn't lend itself to compulsive redosing. Things like coca tea, I think actually should just be over the counter. Like if you're over the age of 18 or 21, like I have no issue with that being over the counter. For powdered insufflated cocaine, like maybe mostly over the counter, maybe there's a licensing process. This is something Rick Doblin talked about a lot, this idea of like an individual could be licensed to purchase and use certain drugs. Rick was talking about more in the context of LSD, that like the first 5 times you used it, you'd go to a center, you'd use LSD with a group of professionals, and then you would be licensed to use LSD. I actually really like that model for cocaine as well, because I think for most users, cocaine would not be any more problematic than coffee. I cannot start my day without coffee. I'm physiologically dependent on coffee. That doesn't really affect my life because coffee doesn't cost me $150 a gram, right? And so if cocaine was inexpensive and available, I don't really know how many more problems we would see. But like if I go 2 days without drinking my coffee, the level of cluster headaches I get is like unbearable. Like I am physiologically dependent on that drug. And yet we don't talk about like, oh, how should we regulate coffee, right? And so I do think that cocaine in particular is one that doesn't necessarily deserve that reputation.
I mean, you're absolutely right. So in the UK, Transform have come up with a blueprint for state regulation of all drugs, and cocaine and stimulants. That's when you talk to people about that, that's the one they really struggle with. But they're absolutely right. You're right. You have to do this properly. You have to do it carefully. And you have to regulate all drugs because it's not safe for people buying them on the streets, that's for sure. The harm reduction.
And I think opiates are a lot trickier than stimulants. I think that one does actually have a slightly higher propensity towards problematic substance use, but the reality is the United States is now losing 50,000 people a year to fentanyl, whereas fentanyl wouldn't exist if heroin was legal, right? I mean, it would exist in a medical context, but most unregulated market users would much prefer heroin to fentanyl. The only reason fentanyl is common is that it's easy to smuggle, right? It's easy to move. Like that's the whole reason it's so common.
It's cheap, I suppose. Low dose. It's such a low dose you need.
Right, it's a low dose, more doses per smuggled shoebox.
Yeah.
It lasts less time than heroin. It's less euphoric than heroin. It's not a more desirable experience. And so, yeah, I mean, 50,000 a year is approaching our peak year of HIV deaths, right? I mean, we're talking about like a massive public health crisis entirely created by prohibition right now in the United States. And it's on its way to you guys. I mean, it is inevitable that fentanyl is going to enter that market.
It has, it's happened. We have the highest rate of drug-related deaths in Europe here. And in Scotland, we have a huge rate of opiate overdose deaths. And, in the UK, way back when, we had heroin-assisted treatment.
Right.
And that just seems like a no-brainer for people, to me, to bring that back. And safe consumption facilities. We really need that as well.
Yeah, certainly good point, Joe, especially as this talk is directly after the regulatory talk was speaking of law and rescheduling and whatnot. I'm currently studying in the Netherlands, and I know the way the Dutch government do with heroin use. There's supervised injection rooms. If you're unable to quit heroin, you can access it for free. So a lot of the social problems tied to it aren't existing. But the massive variance from country to country it's crazy in the modern time, really. But on a population basis of looking across the board and a population that might have more access to drugs, Richard, who's on our panel and who is on our team and who has organized this panel, asked a really nice question about a paper from Krebs and Johansson in 2015 titled "Psychedelics Not Linked to Mental Health Problems or Suicidal Behavior, a Population Study." And this study showed that there was no significant association between lifetime use of psychedelics and increased likelihood of psychiatric illnesses, and also that there was no link specifically to psychosis, even though psychedelic drugs have been used as a psychotomimetic in research. So what do the three of you think of this study, if you've read it, or what you think of, like Mitchell had mentioned, schizophrenia being onset by the use of psychedelics?
It's a huge study. I haven't read it, to my shame, but it shows it's very rare, I think. And you'd like to hope that people with a risk, who know that they've got the risk for psychosis, don't touch these drugs, don't go near them, I would think. But I don't know, Mitchell, Lianna.
Yeah, I mean, I brought up that one anecdotal experience, but the reality is I probably have interacted in my life with 100,000 people who've used psychedelics. Like, I live in the scene, like I'm at these events all the time doing drug checking. And I can count on one hand the number of times I've heard people talk about this. Like, it is exceedingly rare. It's really people who have a genetic predisposition towards these disorders. And often they're starting to use psychedelics around the age that schizoaffective disorder manifests. And so even teasing out, like, did this actually cause it, or was this a trajectory that was already in motion and it just sort of accelerated it, and like maybe a year later this would have been exactly where this person was anyways, right? Like, is always a possibility that we have absolutely no way of testing that I can think of. Identical twins, maybe, like, you could probably, but like, that's a very immoral study to give identical twins with genetic predispositions LSD. I can't think of a moral way to test this idea, but it's just so rare. I just think it's worth mentioning so that people who do have that family history know that this is a possibility. But yeah, I think certainly it's far more dangerous. Like, an individual user is in far more danger driving to the guy's house to get the LSD than they are taking LSD, right? Like, accidents per miles are like quite high in some countries. Like, you are under far more personal risk just going to get the acid than you are taking the acid for most users.
Yeah, can I just to add here that, one of the limitations of science is, like, the survey that was done was over a group of people that selected and chose to do psychedelics for various reasons. They also then opted into taking the survey. And so you have a certain population that might be kind of more geared towards positive feelings around psychedelics. And I think the thing that I'm aware of is that we're talking about increasing the amounts of people who use psychedelics by a lot. I mean, 10x, 20x, who knows in the next couple of years, right? Currently, and when I started using psychedelics, there was a much smaller percentage of the population had an awareness around it or were using them in this way. And so we're talking about largely increasing these numbers, which is why I do think it's important to surface that potential risk factor. And also because we don't want to give people the wrong impression about these things. Another thing just to note is that while some people might not have a diagnosable DSM-5 like negative repercussion from the use of psychedelics, there is this phenomena, at least in the communities I'm part of kind of chasing the peak experience. And it's kind of the merging of like the psychedelic and the wellness culture, where one becomes very kind of self-obsessed in their own figuring themselves out in their own psychological journey. The way that we break down mental health is a very like North American and kind of like Western world approach, where we have this kind of like, egocentric view and definition of the person, where other cultures have a more, a broader sense of who they are in relation to their community, in relation to their spirituality, and in relation to nature. And so I just think that there's this like chasing peak experiences thing where people go from one journey to the next without taking the time to integrate, that can destabilize a person's life in ways. And so highlighting the role of integration, which I think is an understudied field in psychedelics in general, I think that there's a lot to uncover in terms of how one can know when they are fully integrated and really in a more whole place before embarking on a new experience. So while there might not be something that is captured in that survey, I do think that there are still really important things to pay attention to and look out to when engaging with these experiences.
Yeah, it's a really wonderful point.
I'm actually
sorry.
wondering too, I see some stuff, it's hard, I'm on my phone, so I'm having difficulty tracking the comments, but I did see some requests to address the latest, I don't know what to call them, accusations of malpractice of MAPS. I'm wondering if I might get an opportunity to do that before this closes.
By all means.
Great, yeah. Yeah, so I think some of the questions were around like, the elevation of the shaman or the elevation of the therapist in these experiences. And I think in general, that's something to pay a lot of attention to. When I first tried psychedelics for the first time, I remember who gave them to me and what I felt about them afterwards and how I revered them. And I think that that is very dangerous territory, and that, a person's autonomy and that we shouldn't be elevating or putting on a pedestal people who are facilitating these experiences. I much prefer the term facilitator over anything else when it comes to working with these substances, because a lot of these terms are loaded. In terms of the case with MAPS, I'm not sure how much we want to go into this, but MAPS was made aware of this, it was an egregious deviation from the therapeutic manual and protocol that we have well established that this therapist team committed. And there has been an ongoing investigation. We did publish soon after the victim came forward with this information. We immediately published on our website our reports to Health Canada and to FDA. We're very fully aware of the situation and have been for many years. I think that this points to a real issue, which is that there are people that will take advantage of vulnerable people, which is kind of where I started. And so that is something to be acutely aware of. It happens in general therapy. It happens in any sort of dynamic where a person is receiving help from another person. There's so many examples of people taking advantage of others. And unfortunately, we are not exempt from that here in the research of psychedelics. And so, I think that I was grateful for this story getting highlighted and told. I might have some feedback about the way it was told, but generally these notions that there is a lot to be considerate of when entering into vulnerable states with people who you perceive as having power, who you might perceive as having power over you. Incredibly important conversation to surface, and MAPS will have more to say about this. I believe that there's a statement that will be released on Monday if people want to check that out. I know that our team has taken our time in being meticulous in the way that we respond to the current situation, but that this is something that has been on our mind and that we've been in deep awareness of for many years. And it's really a tragedy on a lot of levels, on many, many different levels, that this occurred, especially for the people who were harmed through this malpractice. So yeah, that's all I'll share about that, but stay tuned for more.
Yes, thank you very much for the insight there, and especially that the statement will be released on Monday. Leading on from that though, in what's currently gone on with MAPS, and the way that this information has drip fed into the public eye. A statement coming on Monday might give some closure to the situation. But there was quite an interesting question that was in the Q&A for you, Lianna, of especially considering MAPS's phase 2A MDMA trial and other things moving forward. But do you think pharmaceutical capture is inevitable, especially in regards to integration that you just mentioned, maybe in when psychedelics, if psychedelics become medicalized, these types of soft practices, so to speak, how do you think they will be dealt with in the pharmaceutical age of psychedelics, if that's ever to come?
I mean, I'll be the first to openly share with the audience here that I am not super exuberant about the pharmaceutical, the inevitable pharmaceutical capture of psychedelics, for just the sheer reason that when you have big moneyed interests and you have the profit motive entering into the space of healing, things can get really shifty. And so, yeah, I mean, that's one level. On another level, we're going to have much more ability and regulatory oversight once we have trained therapists who then have a licensure board, and where then a person's license can be removed when a malpractice case comes forward. And so that's a danger of having the drug war and having drugs criminalized, is that we don't actually have, so many people are seeking these experiences in the underground. It is impossible to regulate the underground. And so, you know, of course there are bad things, adverse things happening in the underground because it's unregulated. So on one level, I think like I welcome and I'm very excited about more regulation. I am nervous about what happens and what kind of corners might get cut when people need to hit their bottom lines. I'm hopeful that we, especially us at MAPS, like we're really committed to transparency. We're really open to speaking about these things. We have taken our time to respond to the latest issue just because we really want to get it right. And we feel that this is worthy of that. But yeah, I think the other thing that I believe is that we're not only going to be integrating psychedelics in our culture through medicalized and through pharmacological interventions. I am all for drug policy reform. I'm all for the Oregon Psilocybin Services Initiative, which currently it was approved by the state of Oregon at NFO, and they're writing regulations on how to train people in facilitating psilocybin experiences for anybody. You don't have to have a medical condition, and the people being facilitators do not have to be a licensed therapist. And so there's questions around what needs to go into that training to ensure safety. There's a panel who has a 2-year window. They're a year into their 2-year window of articulating those regulations. But I think it's an incredible, thing. It's an incredible experiment, and we're going to see what comes of it. But I'm very excited about the ways in which we can safely create contexts to have psychedelic experiences, not just in the medical framework.
And I also think it's worth noting that there's a lot of sort of technological changes that are undermining the drug war and the ability of prohibition to work, right? So cryptocurrencies and dark webs were sort of the first generation of that, but yeast that can brew psilocybin already exists. Like that yeast exists, genetically modified yeast. So they take the genes for producing psilocybin from mushrooms, they put it into yeast, and then sugar, water, yeast, and you have psilocybin come out the other end. They've also done this with cocaine. There's modified E. coli that can brew cocaine like in a vat. And so as these genetically modified bacterium and yeast and whatever that can produce different drugs sort of enter markets, like those are going to enter the market. You're going to be able to buy yeast that brews cocaine. And we're not talking 10 years from now. We're talking more like 2 or 3 years from now. And so I don't really know what prohibition means in a world where anyone who wants to do cocaine can brew it themselves in their basement using glass and sugar and water. Like, I don't know how prohibition operates in that world in any sort of, not that prohibition has ever been effective, but like, I don't see how it operates in any way when that starts happening. And so I do think that we're going to sort of see a rotting away of support for prohibition as it becomes more and more clear that prohibition simply doesn't work in a world where these technologies are coming online. Molecular printers are another one. Like currently they're $50,000 and they exist in a handful of chemistry departments in the world. But like that was true for computers, right? That they were $50,000 or $100,000 and only existed at a few universities. And now there's one not one, there's 15 in every home. And so, yeah, I just don't think that prohibition can survive the technological changes that are coming.
So rather than prohibition, it's a more of a management job. The drugs will exist, it's just a matter of how they're used. An interesting point on the part of pharmaceutical industrialization, really, of psychedelics, if that's to occur. Maybe these practices of actually holding psychotherapy will be under more management, more rigorous standardization practices, and ways that the consumer, the patient, knows what they're receiving rather than something being underground. Of course, if that's to be good or bad will yet to be seen. But I have a question specifically for Joe about this. You had mentioned that psychedelics are anti-inflammatory rather than serotonin, which is pro-inflammatory. At what type of doses would you see an anti-inflammatory effect? And if it's a microdose or something that doesn't alter perception too much, would you see it as being applicable to inflammatory neurological diseases like multiple sclerosis?
Yeah, okay, that's a really good question. And this is very new and it's very exciting. But most of the work has been done in animals so far. And the doses seem to be reasonably high. And it seems to be through TNF alpha, so it's a certain inflammatory pathway. And Charles Flanagan's the guy for this, and he has been looking at an animal model for asthma, and shown some really, his work is so elegant. He's shown some really beautiful effects on cytokines and the inflammatory pathways. So I've got a very smart PhD student, and she's doing a review on this and trying to identify the mechanisms, because this could be extraordinary. You have so many inflammatory conditions, inflammatory bile disorders, and so many disorders are caused by inflammation and inflammatory processes. So it's hugely exciting. I'm thinking it would be a different paradigm again. I don't know what the dose will be. There's loads of work needs to be done on this, but this is a really exciting avenue for research, I'd say. Sorry, I have the sun in my face. Sorry about that.
There's also research on autoimmune conditions being treated with psychedelics.
Yeah.
There do seem to be like physiological uses for these substances that we've all been so obsessed with it. And it's interesting because it's almost always at like far lower doses than are psychoactive. And so it seems like what maybe we've been doing is actually taking like even a gram of mushrooms might be like a mega dose of like what a psychedelic, like what that drug can actually do. These are just sort of, brain misfires from a mega dose of these substances. I don't actually think that's necessarily what's happening with psychedelics. But the evidence for this like autoimmune and anti-inflammatory and like, it's so interesting. I don't think I ever would have thought in a million years that even though LSD came from that sort of research, right? I mean, that was the sort of research he was doing was not about mind state. It was about blood pressure medications, basically. So yeah, I mean, thank God Dr. Hoffman was interested in these ergot alkaloids, really changed the world looking for a better blood pressure medication.
Absolutely. Yeah. And, pain, effects on pain. The early studies with LSD showed there were, very powerful effects to reduce pain and people do not want to take opiates, do they? This is a much better paradigm. But it will, again, as you say, be a different paradigm. But we need to understand this better. So we need the research to be enabled. So we need rescheduling.
Well, it's really wonderful you two have mentioned this. We actually have a talk going on tomorrow evening at the same time as this one, the last talk of the day, which is pain and psychedelics. And one of the speakers, James Close and Julia Bornman, will be speaking about psilocybin for fibromyalgia, while Jan Ramakers will be speaking about LSD microdoses as a painkiller. So nice how these things tie into one another. But thank you very much for your question. Your answer on that question. It was
absolutely
quite insightful.
Right.
Knowing where the field stands now.
I think this is extremely important aspect of the therapeutic potential of psychedelics. So the other issue really is about the receptor pharmacology of substances like psilocybin. So we looked into this recently, and actually in terms of a sort of standard drug discovery process, the human receptor pharmacology really is not particularly well understood. of a drug like psilocybin, that is going to become a medicine. And I think that will be important to understand. It's the selectivity really for the various 5-HT receptors. So we all know that they work through the 5-HT2A receptor, but they also have significant affinity for the 5-HT2B receptor, and those receptors are located on the heart valves. So unlikely to have a big effect when you're taking 3 high doses and you don't take it again for a significant amount of time. But since we're talking about inflammation and pain, if you are going to be taking these more regularly, we really need to have a better understanding of the selectivity, the human receptor pharmacology of drugs like psilocybin. And of course, going back to talking about the pharma companies, I think they do have a role to play in developing medicines for people, doing all the safety evaluation, all the talks that kind of is going to be important, and developing second generation psychedelics that that will be potentially more selective. But we did find a gap in knowledge that it will be important to address moving forwards. And the other thing the few questions in the chat about it, is drug-drug interactions, because bringing this for people with severe depression, as a therapy into, our National Health Service, which is kind of the aim, people won't be able to come off their antidepressants, I don't think. And the small trials have shown that psilocybin is safe with certain SSRIs, the standard antidepressant medicines. But what about anticonvulsants? What about drugs like lamotrigine? What about other psychedelics? So those studies will be important to do as well. Again,
really exciting to hear how things might move in the future.
Yeah.
In my mind, at least, I'm sure maybe in some others too, there's almost limitless potential to psychedelic applications. It just matters where they fit the most and they exceed the current gold standard, because that's what the aim always is.
And there
yes,
must be at least
so
a
much.
million of these compounds that we haven't discovered yet, right? Like maybe closer
Exactly.
to 5 million. No one's really working on the salvinorin analog. Salvinorin A is a massive molecule with, probably 200 places you could do sort of modifications and replacements. Like there must be some real interesting analogs of salvinorin that exist that we'll discover someday. If we could tease apart the time effect without the, feeling like you're going through a shredder, that'd be neat, right? Like it's just such a growth field.
Definitely, especially the kappa opioid interactions of salvia. It's really interesting how that drug actually creates its effect. But maybe this could be a talk for next year's event of the upcoming pharmaceutical applications, or even understanding of receptor pharmacology from psychedelics. I think that'd be really nice. But
Aiden,
we've gone a little bit over time.
Aiden, can I just jump in for like a quick parting thought?
Sure thing.
Mitchell just said Albert Hoffman's work changed the world. I posit that psychedelics don't actually change the world, but people engaging with society do. And so that's the thing I really encourage from everyone. That's all.
As always, Lianna,
Yes.
I appreciate your perspective.
Lovely words. Really lovely words. Nice way to end off this first day of the Student Psychedelic Conference 2022. We'll be starting back up again tomorrow at 12:30. All the attendees will receive a Zoom link via email. And I just want to say a quick thank you to Joe, Lianna, and Mitchell for being in this panel. I really enjoyed it. I've enjoyed hosting it. And I'd like to say thank you as well to the rest of the organizers, Anna, James, Dasha, Richard, Alex, Alcione, Joanna, Nadia, Eddie, and Dash. It's been a couple of months in organizing this event, and I'm delighted that the first day has gone so smoothly, especially wrapped up by this nice panel. So looking forward to day 2 tomorrow, starting at 12:30. And I hope that everyone has a nice evening and enjoys the rest of their Saturday.
Thank you for having us. It's been great. I've learned a lot. This panel, it's been brilliant.
Wonderful.
Yeah, thanks for having us.
I have to, so thank you.
Thank you. Bye.
Okay, bye-bye, everyone.